Good evening, Guy. How are you?
I'm well, thank you, Mark. Nice to see you again. Thank you for chatting with me.
Thank you for chatting with us. It's always good to kind of get feedback from people that are in the sports. I believe you're a member at the Fisher Beach Sports Club, and you've been paddling for about 5 years. Surf ski, I believe.
Yeah, well, I've been paddling for 5 years. I'm not sure how seriously that is, but it's I enjoy it, and yeah, it's a great thing. It's a great thing to do.
And the truth is, the reality in most sport, not most people aren't the professional ones. Most people are the guys that are doing it for love of the sport. So it's great. Guy, I just wanted to ask your opinion. So, Canoeing South Africa has taken quite an active stance in terms of getting the federation aligned to safeguarding.
Hmm.
You're a doctor, you're a GP, and obviously over the years there has been, there's been a change in terms of relationship between patients and boundaries that need to be set, which has a very similar look and feel to what canoeing's doing. What is your opinion on that from, I suppose, both a doctor and somebody who enjoys the sport?
Yeah, thank you, Mark. Well, to me, this is a very broad-based social change, a social movement, perhaps highlighted in the last year or so by the Me Too movement, where suddenly everybody is speaking up about incidents that happened a few years ago. So it's a matter of boundaries, of people giving people permission to maintain personal boundaries and not to put themselves at risk, and to be far less vulnerable. And I think there has been a shift, certainly over the last 10, 15 years, I would say, particularly. If I think as a GP, one would quite often in years gone by perhaps do some fairly close examinations of individuals without necessarily getting specific consent or a chaperone, and I think now many doctors would say, if I'm going to do something which may be misconstrued, I'll get a chaperone. In other words, I'll call my nurse and she'll come in with me and hold the person's hand while I look at them. And one does this with minors, with teenagers, with adults, and I think this is the way things are going. And there are two aspects here, I believe. The one is to protect the individuals,
Yep.
but the other is to protect those who are perhaps in authority, and to protect them from being in any situation where they may be accused of inappropriate behavior. And so I think it does work both ways.
Absolutely. We almost create a situation where we protect both in the sporting environment, the coach, and obviously in your profession, the doctor, but we also protect the athletes or the patients in your environment almost through transparency, almost by kind of going, if you want to know what I'm doing, have a look, because I'm not doing anything inappropriate.
Right. Absolutely. I think it's there to protect both parties, and the over the years it always comes out. I mean, we've had a few pretty celebrated cases in this country of where young women have been, as teenagers, have been abused by sporting coaches, particularly in the tennis fraternity, and it takes quite a long time to come out. And I think now the current generation of younger people certainly do set firmer boundaries, and the boundaries that one can cross are much, or the boundaries you cannot cross are much clearer. And I think that one needs to have something in place to protect those who are vulnerable, and also something in place to protect and support those who may be to be seen in a coaching role, to protect them from being in a situation where they may be accused of inappropriate behavior. And I think that is one of the things that I find helpful about about this guardian policy. we had an episode at our club recently where we were concerned about a member's behavior with regard to younger club members. And we were able to say to him, look, the goalposts have shifted. There is a perception here, and you are putting yourself at risk by your behavior. I sent the Guardian policy through to him, and I said, it is important that you understand goalposts have shifted, and you may be making yourself vulnerable to accusations, either by the minors themselves or by their parents. And you know, that sort of thing can be very messy. It can be extremely distressing, both for the vulnerable individuals concerned and for those who are seen to be in a more adult role, perhaps of influence over them. It's messy stuff. It gets into the press, and I think it can be extremely harmful to both parties.
100%, you know, and I think another thing we need to be guarded against, in as much as you're saying this new generation, you know, will speak out, you know, we've also got to be guarded against them making false accusations. And so having somebody with you when you could be in a situation that may be regarded as a little bit, you know, as a little bit untoward, having someone there who can bear witness to the actions that played out, in all honesty, may be the thing that safeguards the coach in the future, you know?
Absolutely, absolutely. And I wouldn't necessarily say the coach is the most important thing, but there are two parties potentially who are involved here. And I do think, you know, with this kind of internet generation, kids are pretty sussed, you know, they much clearer. They know a great deal more than their parents knew at the same age. and they, you know, be aware of any transgressions there. Yeah. I think that your also the ability to report things anonymously, I think is a helpful. I do think that's helpful because an individual may be uncomfortable with a relationship,
yeah,
but not necessarily willing to talk to another adult for fear of humiliation. But kids talk among themselves. And if you have an anonymous reporting app and you get a cluster of kids in a particular club or environment reporting something, you know, it just adds, it just makes it a more powerful thing and easier for kids to do. Of course, it can be abused, but you know, one has to look at it both ways. But I think it is easier for kids who may feel vulnerable to report anonymously. And of course, if one gets several anonymous reports, it just makes it much clearer.
Absolutely, absolutely. Thank you so much for your time, Guy. You know, it's been so. This has been one of the easiest interviews I've ever done. You know, you've got so much insight into what we're trying to achieve. It really is testimony to actually everybody I've dealt with within this federation. There really seems to be a heart for making this sport better, just through in the safeguarding space. So I want to take this opportunity to say thank you very much for your time. We'll get this out. We'll get this interview out. But yeah, for your time, your insight, you know, the stuff that you've gleaned in terms of your experience of being a doctor, being in the paddling environment. So thank you so much.
My pleasure, Mark, and thank you very much indeed.
Absolute pleasure. See you soon.